Dr. Stoff, you helped set up the outreach program to bring cancer awareness to firefighters. How did this come about?
Well, I have been working with patients with cancer for over 30 years and have always worked with people that needed help in this area. Unfortunately, firefighters are exposed to a lot of chemicals, many of which are carcinogenic, and are at much higher risk of getting cancer than other people of the population. So, over a period of time, it was just a natural evolution of me working with more and more people who are firefighters because of their exposure to these toxins and their eventual development of cancer. And as a result of that, I've always been interested in education, and it just naturally evolved as a educational process to try to help this population.
Dr. Stoff, as you know, I'm a retired New York City firefighter. I spent a lot of time down at Ground Zero. We have a lot of firefighters that are sick, and a lot of us are dying. What do you feel is the ultimate outcome of the issues from 9/11?
Well, there's been a lot of research and study as to the range of toxins that people were exposed to and that they potentially absorbed as a result of 9/11. On the one hand, many of these toxins are highly carcinogenic. In other words, they can initiate and trigger cancers. On the other hand, they're immunosuppressive. They suppress the immune system and its response to cancer. So these toxins are doing double damage to people that have been exposed to them. We have tests that are available now, urine tests and blood tests, to see what toxins the person has absorbed, what toxins are still in their system. We have ways to pull these toxins out through different substances that are chelators that can pull out heavy metals, that can pull out volatile organic hydrocarbons, that can pull out a lot of the things that can lead to cancer down the road. So from a preventive point of view, doing these kinds of tests and seeing what toxins are still in the person are very helpful. Coupling that with technologies like IV gene and with 4D ultrasound, with MRIs, etc., to see what is brewing, what's going on at a very early stage, gives us the opportunity to intervene very effectively with minimal invasive treatments to help people prevent severe cancers that can be life-threatening. So it's a huge problem, and unfortunately, it's sort of like the same thing that we saw from Chernobyl. That initially there was a huge increase in the production of thyroid cancers that occurred, and then for a number of years the incidence of cancers dropped quite a lot. Now we're in the second wave of cancers from Chernobyl, where we're seeing cancers of everything else because of all the radiation those poor people were exposed to. It's the same sort of thing with 9/11. Different toxic substance, but the same sort of response by the body and the immune system to these toxins that the people have been exposed to. And I can't stress enough how important it is to find out what's in your body now. What's the structure of your and function of your immune system now to protect you, so that things can be dealt with before things show up abnormal in something as early as an IV gene test.
Dr. Stoff, your campaign to bring to the public a review of cancer treatments, this has to be a huge project.
In general, the more that we know about in terms of different strategies for addressing cancer, the more options we have, the more hope that we have for a successful outcome of helping a person get either a durable remission or a stable process with their cancer, converting it into a stable long-term disease process, one that won't interfere with their quality and quantity of life. With the technology that we are evolving now, it gives us these possibilities.
I see that your program is to let everyone know that there's so much more out there than just chemo and radiation. Is that the standard?
Well, it used to be. Now with the rapid research that's gone on in the field of immunology and immuno-oncology, for many cancers there are immune therapies that are first-line therapies instead of chemotherapies. When you go to an ASCO meeting now, the American Society for Clinical Oncology, for every pharmaceutical company there talking about a new chemotherapy drug, you'll find 10 talking about the latest immunotherapy drugs or different sorts of medicines that are small molecule therapies, things like enzyme inhibitors, things that aren't chemo, but find other ways to block the activity, growth, and life of cancer cells without having the high level of toxicity against normal tissue. So the old paradigm of chemotherapy, radiation, and surgery is being replaced by a more effective therapy, a much less toxic therapy, and this is evolving before our eyes. I mean, I have therapies now that have put people into remission that 5 years ago would have carried a death sentence. So to see these medicines that are available now and how it's changing the whole way that we think about the field of oncology is just magnificent. It's such a exciting time to be practicing in this field. I very much enjoy it.